Have you ever experienced the discomfort of your ears popping during a flight? While that sensation can be unpleasant, ear infections take this pain to a whole new level. For those who have dealt with ear pain or recurrent infections, the experience can be both frustrating and exhausting, often disrupting sleep and daily activities. But what if there was a simple, natural remedy in your pantry that could help? Enter apple cider vinegar, a versatile substance that goes beyond enhancing salads and can potentially provide relief from mild ear infections. This video delves into how apple cider vinegar can help with ear pain and the best practices for using it, while emphasizing that it should not replace medical advice. Understanding ear infections. Before exploring apple cider vinegar as a remedy, it's essential to understand what ear infections are and how they occur. Ear infections can be caused by bacteria or viruses and can affect any part of the ear, including the outer ear, eardrum, and inner ear. The Centers for Disease Control and Prevention notes that ear infections are one of the most common reasons parents take their children to the doctor. While many ear infections resolve on their own, some can lead to inflammation and pain, which may require treatment to prevent complications like temporary hearing loss or more severe issues. There are two primary types of ear infections: acute and chronic. Acute ear infections come on suddenly and can be painful, but typically last for a shorter duration. According to medical experts, acute ear infections often coincide with upper respiratory tract infections, affecting millions of children annually. Chronic ear infections, on the other hand, can be persistent, may recur frequently, and can potentially lead to permanent damage to the inner ear if not addressed. The American Academy of Otolaryngology highlights that chronic infections may be associated with underlying conditions that need medical attention. What causes ear infections? Ear infections result from trapped bacteria, viruses, or fungi in the ear canal or middle ear. While anyone can develop an ear infection, children are more vulnerable. Factors such as allergies, colds, flu, and exposure to smoke can increase the risk of developing a middle ear infection. Water trapped in the ear canal after swimming, particularly in public pools, can also lead to an outer ear infection, commonly known as swimmer's ear. People with certain health conditions, such as type 2 diabetes, are at higher risk of ear infections. Skin conditions like eczema and psoriasis can further exacerbate susceptibility. An earache should not be ignored, as it can be an early indication of an infection. Ideally, mild pain should subside within a few days, but if it persists beyond 3 days, medical attention is recommended. Children are particularly prone to ear infections, so signs like ear discharge, imbalance, or fever should prompt a visit to a pediatrician. The effectiveness of apple cider vinegar for ear infections. For mild ear infections, there are a few home remedies that may help alleviate symptoms, and apple cider vinegar is often at the top of the list due to its antimicrobial properties. Apple cider vinegar's effectiveness stems from its high acetic acid content, which has been shown to have antibacterial properties that can combat harmful bacteria. A study published in the Journal of Food Science revealed that acetic acid is effective in inhibiting the growth of common bacterial strains, such as Escherichia coli and Staphylococcus aureus, which are often linked to infections. Apple cider vinegar's antimicrobial nature also extends to fighting fungi. Research indicates that apple cider vinegar may be effective against bacteria, fungi, and even viruses. A study on the antifungal effects of apple cider vinegar demonstrated its efficacy in combating Candida albicans, a common fungal pathogen. However, it is essential to understand that while apple cider vinegar can be helpful, it should not replace professional medical treatment and is best used for outer ear infections. Any deeper or more severe infection should only be treated under a doctor's supervision. The Mayo Clinic advises that infections affecting the inner ear may require antibiotics or other targeted treatments. How to use apple cider vinegar safely for ear infections. Dilute the apple cider vinegar. Mix equal parts of apple cider vinegar and warm water. Ensure that the water is mildly warm. Hot water could exacerbate pain. Maintaining the correct temperature is important, as temperatures exceeding 100 degrees Fahrenheit can cause additional discomfort or damage. Apply the solution. Use a clean dropper or baby syringe to put 5 to 10 drops of the solution in the affected ear. Cover the ear with cotton or a clean cloth and lean to the side to allow the solution to penetrate. This method helps keep the solution in the ear long enough to exhibit its antimicrobial effect. Wait and drain. Stay in this position for about 5 minutes before switching sides or draining the solution. Allowing the solution to remain for an adequate amount of time ensures better efficacy. Repeat as needed. This process can be repeated a few times a day until the symptoms improve. If no improvement is seen after 3 days, it's important to consult a healthcare provider. Additional home remedies for ear infections. Warm or cold compress. Applying a warm or cold compress can relieve ear pain. This method is safe for both adults and children and can be done multiple times throughout the day. For added relief, alternate between warm and cold compresses every 10 minutes. Over-the-counter pain relievers. Ibuprofen and other over-the-counter pain relievers can help reduce ear pain and manage fever. Always follow dosage instructions and consult a pediatrician for the right dosage for children. Avoid giving aspirin to children under 16 as it poses health risks. Naturopathic ear drops. Ear drops made from herbal extracts are widely available and can help manage ear pain. Some naturopathic drops even include ingredients like garlic and olive oil. Research supports their effectiveness in pain relief, though their ability to eliminate infections is still debated. Adjusting your sleeping position. Believe it or not, your sleeping position can impact ear pain. Sleeping with the affected ear raised can aid drainage and reduce discomfort. Using additional pillows to elevate the head can also help, but ensure they are of an appropriate height to avoid neck and back pain. Memory foam pillows that support head contours can provide additional comfort. Garlic. Garlic is widely regarded for its medicinal properties. It boasts anti-inflammatory, antibacterial, antiviral, and antifungal effects. A study even found that ear drops containing garlic were just as effective as over-the-counter ear drops for children with ear pain. You can buy garlic oil drops or make your own by soaking crushed garlic in warm olive or sesame oil. Be cautious when preparing homemade drops. Improper sterilization can lead to bacterial growth. Ginger. Ginger's anti-inflammatory properties make it an excellent remedy for soothing ear pain. Ginger-infused oil can be applied around the outer ear canal, but never directly inside the ear. To make it at home, steep grated ginger in warm olive oil, strain, and apply externally. Hydrogen peroxide. If earwax buildup is causing discomfort, hydrogen peroxide can be an effective solution. Place a few drops in the ear. Let it sit for a few minutes, then drain it. This can be done up to 3 times a day for a week. If symptoms persist, seek medical attention. Olive oil. Olive oil, known for its antibacterial properties, is another safe option for treating mild ear pain. Ensure the oil is just warm, close to body temperature, to avoid burns. As with any oil treatment for children, consult a doctor first. Thanks for watching. If you found this video helpful, don't forget to give it a thumbs up and hit that subscribe button, and turn on the notification bell so you won't miss any of our future uploads. We'd love to hear your thoughts or personal experiences, so drop a comment below. Stay healthy, and see you in the next video.